My name is Desmond. I'm a surgeon in Dublin, Ireland. I spend most of my time operating on patients with diseases of the abdomen or tummy or stomach area. In particular, I do a lot of operating on patients who have diseases of the intestine. That can either be of the small intestine or of the large intestine. We often refer to the latter as the colon or rectum, and therefore patients who have diseases of that site we often refer to as having a colorectal disease. Some of the common diseases that affect these areas requiring surgery include inflammatory bowel disease and cancer. There are also patients who fall into categories outside those two who would need to have intestinal surgery. In particular, I like to expose my patients to the simplest, most minimally invasive option possible. And what we mean by this is that we would do laparoscopic or keyhole surgery using small incisions and long instruments rather than the old-fashioned way of large incisions. There are many advantages to this for the patient. It's a less painful operation, of course. As a result of it being less uncomfortable and less painful, we don't need to give as many morphine-like drugs. These are drugs which, although they work tremendously well in terms of pain, can sometimes alter the ability of our sensorium or the ability of our mind to work clearly. As a result, laparoscopic or keyhole surgery, since it uses less morphine-like drugs, the patient tends to have a more clear recovery. In addition to the fact that there are less wounds, or less smaller wounds and less pain, the patients tend to have a faster recovery. There are multiple reasons for this, but one of which, of course, is because the wounds are smaller. Operate in a very narrow field, it forces the operator to be extremely precise with sealing of tiny little blood vessels. So there does tend to be a little less bleeding, and the dissection can be a little more precise. The vision can be enhanced by use of the camera systems that we use in a modern age. So we actually get better visibility with laparoscopic or keyhole surgery than we do with traditional open surgery. This is often difficult to show in randomized trials and studies, but certainly it is our experience that patients tend to have less small bowel obstruction problems, less adhesion problems, and less difficulties internally in terms of scarring. And that may relate to the fact that there is less bleeding and less use of swabs, less use of foreign bodies and materials inside. Overall, from the patient point of view, people find it much more acceptable having laparoscopic surgery than open surgery. It's not just that that there is this emotion that keyhole surgery is less invasive and better for the patient, but also the cosmetic aspects to it, which of course is very important, particularly for the younger patients, many of whom we're operating on for benign disease. And it's important for them that they have good cosmetics, good cosmesis, as we say, that is, that the wounds are small and heal nicely, and that we can bury these wounds into the natural surfaces and contours of the body such that they are relatively invisible. So that's it. I hope this has given you some extra insight and understanding as to what it means to have surgery, particularly to have keyhole or laparoscopic surgery.